What the hell?
See from here, you draw a mid-clavicular line. All right. It cuts the inguinal ligament. What is that point called as? Mid-inguinal point. What is the importance of mid-inguinal point?
McBurney's
I think so. No, la, no, no, posterior la.
Posterior.
No. Yes.
This is on record.
What is the importance of mid-inguinal point?
Is it the insertion of the transverses and the internal? Is it the insertion points?
See, remember, mid-clavicular line has got 3 important landmarks. All right. Let us take the right side, left side. In the 5th intercostal space, you can mark the
Apex.
apex of arch. Clear? On the right side where it cuts the costal margin, this is costal margin, right? The place where it cuts this costal margin, this area, this is called as yes. Morrison's point. Clear. Where it cuts the inguinal ligament. This is inguinal ligament, huh? This is called as clear. Now 3 points you can mark a single line. One is you can mark the apex of the arch just medial to the mid-clavicular line in the 5th intercostal space, place where it cuts the what is it?
Costal
margin.
This particular area is called Morrison's point. That is where you mark the fundus of gallbladder.
Oh.
Understood? You mark the fundus of gallbladder. Second, when you come down, the same straight line cuts the mid-inguinal point. The place where it cuts the mid-inguinal point, just below that is the landmark for palpation of femoral artery.
Femoral artery.
Understood?
To check for
So
radiofemoral disease.
it's a single line that cuts through all this. So remember, in the body there are few lines which all of you should know. One is mid-clavicular line, the second is transpyloric line, then you have the intercostal line. Clear? So all these lines are very, very important. Okay? McBurney's point is not based on mid-clavicular line. It is based on the point between anterior superior iliac spine to the umbilicus. You draw a line, imaginary line, and divide it into 3 portions. The junction between the medial 2/3 and the lateral 1/3, that is called the McBurney's point. McBurney's point corresponds to,
Appendicitis.
if you say only appendix, that is kindergarten, Tadika.
The point of
Which part of appendix? Appendix is long.
Distal models.
What are the parts of appendix? What are the parts of appendix? Very simple. It has got
Body.
a tip, it has got a body, and it has got a base. Which one?
the tip.
Tip is always moving
Base.
like a clock, so it's only the base. So
Oh.
base of the appendix is always marked with McBurney's.
Oh,
Base of appendix. Okay.
Clear? Okay, what is the importance of blood supply to appendix?
Only one artery.
it's an artery.
Huh?
End artery.
Okay, it's end artery. Next. correct, it's end artery. See, you have appendix, something like this. Then you have the small
This is a
intestine
watershed line. or
coming
something.
here. This is the cecum, huh?
Yeah, it's
Now, what is the name of the artery supplying this?
Appendicular.
Appendicular artery is a
Appendicular
branch of?
artery.
Idiocolic.
Okay, idiocolic artery. Fine. What is the importance? Why it's, even though it's end artery, why it's important?
Ischemia.
Yeah, ischemia will occur. What is the importance? I have drawn something here.
Maybe appendectomy.
Oh yeah, for ligation.
Probably ligation and appendectomy or something like that.
Yeah. See that?
I don't know.
Did it?
Yes,
It should be correct.
I don't know.
Now I am the next batch and all. I am not leaving them without drawing diagrams because I am also losing touch with drawing. So I am making others also draw. Yes. This is appendicular artery supplying the appendix. Why it is important?
During surgery.
Something related to end artery and necrosis. What is this? Remember always, if the artery gave direct branches separately to all the parts of the appendix, nothing will happen, though it's an end artery. But here what happens, the artery comes to the base first and then it starts to supply the appendix from the base. In case of appendicitis, the artery is immediately, inflammation will immediately cut off the artery here itself. So the whole of appendix will immediately lose blood supply. Understood? So once immediately it loses, the tip will be the one that first will immediately fall off. Clear? Once the tip falls off, what happens? All the contents inside, which are nothing but mainly fecal matter, immediately it will go into the
Oh shit.
Peritoneum, no?
peritoneal cavity.
Because peritonitis.
Understood? This is the problem with
Appendicitis.
Understood? Because the artery at the base itself, it will be cut off. So the entire appendix loses blood supply if appendicitis is not controlled immediately. Alright, that is the importance of appendicular artery. Alright? So remember, in the thorax, you should know what are the boundaries of thorax, mediastinal boundaries, what are the contents of middle mediastinum. Alright, what is the content of middle mediastinum?
Pericardium, heart.
Okay, heart and pericardium. Okay, fine. Then what else? Lungs and all of you should know. Lungs is very easy, but you should know.
This middle mediastinum.
If I ask you what is the arterial supply to lungs, what will you write?
Lungs. Middle.
Lung.
Okay. What is the arterial supply to the lungs?
Bronchial arteries.
Bronchial arteries are the ones which supply the lung. Remember this, not pulmonary arteries. When I ask you what is the arterial supply of lung, then it means which artery is supplying oxygen to the lungs, because that is also a tissue that should survive. Understood? So it is which artery?
Bronchial.
Bronchial arteries, not pulmonary arteries. Understood this? Okay. Histology, all of you know, right? What is the difference between all these things? Okay, fine. All of you will know. Alright, enough. If you want to see the structures, you can see.